The Dental ETC software provides some powerful functionality with regards to summarizing the patient exam and preparing the protocols for the patient as well as the patient report. In this video segment of our Dental ETC tour, we're going to show this functionality by showing how to print the protocol and the patient report. At the conclusion of the exam, after all of the information has been entered into each of these tabs for the various dental areas, and the appropriate risk categories or risk classifications have been determined, this is easily accomplished by clicking on the print button and identifying the specific protocols that you wish to print and prepare, as well as the reports. You can see here we've entered a check mark next to the periodontal and the caries protocols, and we've identified the specific protocol that we wish to use here. We click the print protocol button, and the PDF print dialog box opens up and gives us the option of saving this document to our computer or to open it directly, which is what we will do here. By clicking the open button, the protocol opens. As you can see, this is a case type 2 protocol as determined by the patient exam and the diagnostic classification that was entered there. And what produces here is the exact protocol that we had pre-established during the protocol setup for a case type 2. In this case, we have 4 visits, and you can see each of the line item procedures within each visit. In my office, we print this document and I hand it to my office team, who then takes this information and directly inputs it into the practice management software. Those software packages normally make this easy. If you have a standardized protocol in this fashion, you can enter all of these line items in a given appointment visit using a multi-code or explosion code, as the case may be, in the practice management software. There's some distinct advantages to having this produced like this, because now with this identified in this fashion, everybody in my office and on my team, especially with the patient, is on the same page with regard to the philosophical approach that we take in treating periodontal disease that presents with this clinical findings and risk factor presentation. There's no question, there's no doubt, and nothing is lost in translation between the point of diagnosis and the execution of treatment in the treatment rooms. As we close this now, we will go to the print report section. Again, we're going to print a report, and the PDF dialog box opens, giving me the opportunity to open or save. We're going to open as before, and now we see the patient report as it prints out of the printer. The introductory paragraph or 2 at the top orients the patient as to how to read the report. It restates the concerns they gave us when they showed up for that appointment. The first section is the periodontal health report with some beginning explanatory comments about periodontal disease and the oral systemic connection. The next section discusses their periodontal diagnosis and shows the relevance of their diagnosis to the general health, talking about bacterial biofilm, C-reactive protein, and other elements of the oral systemic connection. As we scroll down, we then see a listing of all the risk factors and clinical findings that we identified during the exam. Each of these selected by clicking in the exam form returns a bullet point of that item, along with some brief explanatory language discussing the relevance of that risk factor or clinical finding as it relates to their health as well as to their oral health. Then we then have a summary of the recommended treatments, which is not a restatement of the treatment plan, but that enforces the diagnosis and an understanding of the importance of treatment. As we scroll down, because we selected the caries report, you can also see the caries report with its introductory paragraphs. In a similar fashion, we have an explanation of their risk category. In this case, it was high, and so there's a graphic display illustrating that they have a high risk for caries. This is followed by a statement of the caries treatment recommendations and the specific things that will be accomplished in the office and at home to help them get better, all driven by their case type or their risk category selection during the exam. And then similarly as above, we find a restatement of each of the clinical findings and risk factors with explanatory language describing the relevance of that risk factor or finding as it relates to their dental and their general health. And again, a summary of the recommended treatments and the importance of treatment. This document constitutes great informed consent, gives them good patient education, and helps to summarize the importance of treatment as well as review the consequences for not pursuing care. You will notice at the top of the report there is a box that has instructions for the patient to log on to a website entitled myhealthreport.info. It gives them a special password, and we will discuss that in another video.